doing? I welcome you back to my YouTube channel. This is Jemienaftaly on the pediatric world. Remember, it's only in this platform whereby we talk on common illnesses affecting children while growing up. So in today's episode, we are continuing with the hypoglycemia in children. Remember, the low blood sugar levels, and we are going to do the complications of hypoglycemia. What does low blood sugar levels complicate into? So number one, it can lead to altered consciousness or coma. The babies are not alert, they are unconscious. So this can lead to altered consciousness. So we can see unconsciousness stroke coma is both a complication and also a presentation. Remember, on clinical signs and symptoms of hypoglycemia. Hope you note that. It can also complicate into convulsions. Remember, again, convulsion was also a clinical signs and symptom. Again, we are saying it is also a complication. So it can even lead to death. Remember, when you were starting hypoglycemia in children, the low blood sugar levels, we said this is a killer disease if we don't act quickly. So it can lead to death, and we really don't want to lose these babies because there's not something we can do as fast as possible. Patients with severe malaria, hypoglycemia is associated with threefold increased risk of death. What does this mean? It means that if the babies have severe malaria and on top they have this low blood sugar level, so it is severe malaria plus hypoglycemia, so they have threefold, like it is 3 more times risk of death. So I hope you understand this. So the more the baby is severely ill, and on top of that they have hypoglycemia, they are at increased risk of death. Also, it is associated with increased risk of permanent brain injury, and this is very, very serious. You hear me talk of mention something we call CP. This is cerebral palsy, and now this is it. It is the permanent brain injury. Remember, this is very irreversible and you cannot reverse it. When the brain is permanently damaged, that is it. Imagine, it's that serious. So hypoglycemia will lead into a permanent brain injury. The CP, we shall have a topic on its own on cerebral palsy. We keep mentioning it. So those are the most serious complications of hypoglycemia, of low blood sugar levels. Imagine. Now let's go straight to see how to go about treating the treatment and management of hypoglycemia. So in case the child is not able, in case one is not in a setup where they can be able to do a random blood sugar level, so it is recommended to give a bolus of IV glucose if the child has 2 things. One is altered consciousness. This child is not alert, is unconscious. Also, if the child is unable to drink or breastfeed. So what are we saying here? We are saying the best way to know if the sugars are within the normal is by doing a random blood sugar level. But when you are in a setup whereby you're not able to check, maybe you don't have the machine, the what is required to measure. So, and this child has altered consciousness, and they also not able to feed or breastfeed for the small babies. So it is recommended to first give a bolus than ignoring. Just give a bolus. Remember, we said a bolus is giving and giving through the IV. IV is through the vein, so we give an IV bolus, and it's only in these 2 conditions: if the child has altered consciousness and also if they are not able to feed or breastfeed. Hope you understand. Sick children don't need to be given oral glucose powder. They should be fed. So those sick children, you're not supposed to give oral glucose. They should be fed. They should be given food instead to increase the blood sugar levels. In neonatal period, neonatal are the smallest, the small babies. And neonatal period, remember we mentioned, we said these are babies from 0 to 28 days. That is a neonate. So it is basically a 1-month-old baby. So these babies who cannot breastfeed don't require IV glucose. Remember, these babies are so small, so, and you do not want again to complicate even more. So they do not require IV glucose. You don't have to go through the vein. Instead, encourage breastfeeding. So they're very small to get the IV glucose. Do the feeding, the breastfeeding, and for bigger children also feed. I hope this is clear. It's not to all babies, it's not to every child whereby we go giving IV bolus. We have said the first one where and in what instances we do. But if only you do, in this now neonates, the small ones, we are saying we don't give IV fluids, but the only time we do IV dextrose through the vein, it is if you do the random blood sugar, you do the levels, and the levels are below 1.1 millimole per liter. So this is when you go on, because this is emergency and you want to really bring these sugars up fast, so quickly. So this one will need an IV dextrose. We do IV dextrose. The bolus is given through the IV as fast as possible. Beyond neonatal period, now these are bigger children, it's not like the neonate. Beyond the neonatal period, treat with IV dextrose if the blood glucose levels are below 2.5. These ones, it is recommended because they are bigger. They are not like the neonates, the small babies. So here you do the IV glucose, the IV dextrose, if the blood sugar levels are below 2.5. Note that in severe malnutrition, remember there was also a note, we said hypoglycemia is sugar levels below 3 millimoles per liters in children with severe acute malnutrition, not below 2.5 like a normal baby with no malnutrition. So in severe malnutrition, you should correct the hypoglycemia if the blood sugar levels are, that is just a repeat of the same, we're just insisting of it. So in severe malnutrition, correct hypoglycemia if the blood sugar levels are below 3 millimoles per liter. So hope you understand the 3 instances for the neonates and for the neonate also. But if the blood for the neonates, if the blood sugar levels are between 1.1 to 2.5 millimoles per liter, they're not as the small ones. We are saying we don't do IV dextrose. We are saying we breastfeed. But for those with 1.1, between 1.1 to 2.5 millimoles per liter, we consider immediate nasogastric tube feeding using the expressed breast milk. You don't go to giving, because they are bigger than those below 1.1. I mean, they are better than those below 1.1 millimoles per liter. So those are bigger, so you can just you put an NG tube, a tube that passes to the nose, through the throat and into the stomach to feed this baby. And we are saying what we feed on is the expressed breast milk. So you ask the mothers to express the breast milk, and we put through the NG tube as we measure because they might not be able to breastfeed. So you use the nasogastric tube. We call it the NG tube. So I hope this is clear. You got all those for the severe acute malnutrition, for the neonates, and also for the other kids. So AVPU at A or V, remember our scale, the AVPU scale, we talked about it in our previous episode. The AVPU, we said this is a scale that we use to measure the level of consciousness in children. So if this baby is AVPU at A, meaning this baby is alert, and if they are AVPU at V, they are able to respond to voice, then immediate feeding is a preferred choice, because these babies are not they are not badly off because they are alert, and at least they are able to respond to V. So we prefer feeding them so that these the blood glucose levels can really come back up. to normal. So this is how we treat. Now you know the complications of hypoglycemia. You can see how dangerous this condition is. So we don't want again to lose. We are saying the complication is up to death and even permanent brain damage. And also now we have seen how to treat it. So in our next episode, we shall continue managing this hypoglycemia. So we want to go bit by bit so that people can be able to understand. Thank you so much, my people, for listening, for tuning. Remember to subscribe. Those who have subscribed, thank you so much. I appreciate. Those who haven't, please hit on the red button, the subscribe button, so that you may be part of us. Also, turn on your notifications so that you are among the first people to know every time I post a new video. Leave a comment down concerning the hypoglycemia. If you have any question, anything concerning this topic, anything about children, you can pin your comments down there. So, thank you, my people, again. Till next time.